Well, hello there, and welcome to Core Health. I'm Dr. Brian McKay. You're going to be meeting with me in a little while, and we're going to do an exam. And if it's serious enough, we're going to probably take an X-ray. What I like to do is go over a couple of things so you know what to expect on your first visit here today. Very important that you understand we only take the conditions that we know we can help, and that's the purpose of the exam today. Find out what your problem is, and if it's something we can help, we're going to let you know. Now, occasionally we do need to take x-rays, and that helps us understand what's the cause of your problem, and again, if it's something that we can help. What I'd like to do is I'd like to go over a good x-ray and a not so good x-ray. So here's a neck x-ray. The one on the left has got proper curvature. You have good space in between the bones, so there's no issues with the disc. Chances are, if your x-ray is like that on the left, you do not need to be here. Now on the right, we're looking at a very similar x-ray, but it's not too good. And what happens on this x-ray on your right, where it says not so good, is that your x-ray, your curve is lost. And what that does is it places demand on the disc and on the muscles behind the vertebra and actually up into the neck and shoulder area. So when the weight of your head is not supported properly, you're going to have a problem, and it could lead to pain in the neck, sometimes pain radiating down into your arms. Those are the things you have to look out for because it does need to be treated, and you're in the right place if you have something wrong with your x-ray and if we find something on the exam. Let me stop for a second and say, if you've never been to a chiropractor before, you don't know what to expect. When you come here as our office, there's three things we want to operate on. We want to be safe, we want to be comfortable, and we want to be effective. And those are the three hallmarks. So people sometimes think, is it going to hurt worse? They're a little nervous. You've never been to a chiropractor. I promise you, we're going to be very gentle. We're going to be safe. We're going to be comfortable. And we want to be effective. We need to be effective for your sake. Let's turn your attention to an MRI. Now, MRI is very different from an X-ray. It shows more soft tissue. On the left side, we see good. You have spacing. You don't have any impingement on the spinal canal. The nerve roots look good. It's a wonderful MRI on your left. Now, on the right one, where it says not good, you have a herniated disc. Herniated disc, sometimes called bulging discs. Sometimes, if it gets really bad, we call it a stenosis, a spinal stenosis. And those are conditions that we can help. We have to relieve that pressure and trying to get that disc back to where it belongs, because the disc acts like a cushion shock absorbing mechanism. It also allows for proper spacing so it doesn't impinge on the nerve root. Chiropractors call the condition when the bone is out of place a subluxation. Yes, it's a big $3 word. If you're playing Scrabble, it's a great word to have. But basically, when you have a subluxation, the bones are not working for you, they're kind of working against you because they put pressure on the disc, pressure on the nerve, pressure on the spinal canal, and you end up having a lot of pain. So we kind of want to see that image on the left. And if not, we have the image on the right, then something needs to be fixed. So that's something we will determine during your exam. But again, your exam is going to be comfortable. I'm going to talk you through it. We're not going to do anything that hurts. So you put your mind at ease. All right. So once we go through the exam and we take x-rays, it's going to help us determine how we can best help you, if we can help you at that point. So again, we want to make sure your comfort. We're going to answer all your questions. If you have questions, feel free to ask. It's not a problem sometimes. And if you have more than one problem, I would like to know about it now, because sometimes people don't tell me everything we have to work on right away. So at the conclusion, here's what we're going to look to do. You're going to need to know if we can help you. We do not take the cases on we cannot help. And in some cases of that, I will probably order an MRI and refer you to a different doctor. Most times, if we refer you out to a different doctor, they would see you and then send you out for the MRI. I always think it's better to go in with the MRI and figure things out there. The next thing if we can help you, how long is it going to take to fix the problem? That a lot of times that's determined by how long you've actually had the pain. That if it's been 3 weeks, well, it's probably going to be easier to fix than if you've had it for 3 years. We don't know until we get the whole exam and x-ray procedure down. Next thing, you're going to want to know how much it's going to cost. We usually tell you that on the second visit because our staff will take the time to call your insurance, verify it, and come up with a plan that works to make the care affordable. So, with having said all that, let's get started and let's get the exam going. I'll be in a few minutes. Put your mind at ease, get your questions in order. Feel free again to ask any question. We're here to help you. And thanks for choosing Core Health.